So greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And today it is my very, very great pleasure to welcome Kathleen McDermott. Kathleen is a nurse, a health coach, a health writer. She's an entrepreneur. She's had over 24 years in this business, and most of that time she's been in the hospital. She says that after 12 years, she became supervisor for home care nursing agency. In 2023, she became a certified health and life coach, and her focus is to help women going through menopause who are not necessarily understanding their symptoms and using things like food and alcohol to cope. So, welcome, Kathleen.
Hi, thanks, Dale. Thanks so much for having me.
Thank you for doing this. Thank you for doing this. So, the first thing is, why are you a nurse, though? What brought you here?
Well, let's see. I have always enjoyed the healthcare field, but I
Uh-huh.
did not become a nurse until I was actually 34. It was a
Okay.
second career. So I worked on Wall Street,
Mm-hmm.
ironically, and I was in finance. It had nothing to do with healthcare, except the gentleman that I worked for was a psychologist, and he was providing feedback to some partners at the firm on how they could work better to support the staff that reported to them. And he would
Uh-huh.
get a lot of material that I would have to file that had to do with healthcare. So one thing led to another. I ultimately went back to school and became a registered nurse. And I've loved my career. Like you explained, I worked for 24 years, and it really was a perfect career for me. Half the time in the hospital setting, and then I overlapped into home care. And even sometimes I would take care of patients in the hospital that I would then see in their home, which was very interesting, or vice versa. So
Mm-hmm.
I would get a real clear picture of, the controlled environment in the hospital versus when a patient goes home and
Mm-hmm.
they kind of fall back into the patterns that we all have, right?
Yeah. Yeah,
Yeah.
yeah, 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 yeah. So, but coming to it as a second career and from finance too. Um, First of all, what skills translated? And secondly, what were the challenges?
I think one big skill that comes to mind is that I worked for a very well-known financial company that held their employees to a high standard. So if you worked there, you really had to have a good work ethic. And I carry that transfers really into any profession, right?
Yeah.
So I continued that very ethical behavior, hardworking into healthcare. But I just saw the importance of, this gentleman I was working for at the financial firm was using his skill set to help the top partners at this firm psychologically, how they were behaving with the people that reported to them. So there's mental health, there's physical health, and
Yeah.
it happens obviously in the healthcare setting mostly, but it happens out in every
Yes.
area of work, right? So I would say the biggest skill set that I transferred over was really just working hard and holding myself to a high standard.
Mm-hmm. Yeah, yeah, yeah. How did it challenge you? Second career.
Gosh, yeah. Well, I had young children, and I was very motivated to do well because I was a bit older. So I didn't want to repeat classes, and so I
Mhm.
did complete obviously schooling. But there's a lot to learn in nursing, and you learn a lot in school, but there's nothing like learning on the job and seeing, the real life um, instances
Yeah,
of all that you have to be able to
yeah,
do as a nurse, and then learn from all the nurses that are mentoring.
yeah, yeah, yeah. I say that nursing is all about all about pivoting and assimilating and changing. And you learn a lot in school, as you just mentioned, but really, yes, you need to have knowledge. A lot of it is guideline, because when you teach, work with so many different people, you really have to switch that around to deal with a particular person, a particular way, even though they both may have the same thing going on. It's so different for each of them.
Sure.
So then you became a life and health coach, and you were focusing on people in menopause. Why that section of community?
Well, because of my own personal journey. So I was working my last 12 years as a nursing supervisor, and I started to go through perimenopause and menopause and had a very difficult time, was not getting the answers from the medical community because it's not something that the doctors get a lot of training in, nor did we as nurses. So I had to do my own research. I ultimately hired a health coach for support and accountability, and then recognized that I really wanted to pay it forward and continue to help women that are out there, raising families, working full-time or part-time or whatever their responsibilities are, how to slow down and take care of their symptoms, because the menopause is inevitable, but the suffering should not be, right? And there's a lot we can do holistically with every lifestyle choice we're making to better manage those symptoms. And of course, there is a place for hormone replacement therapy, and I can educate them on the questions to ask their doctor, but the prescription clearly comes from their physician.
Do you think that, as you see all these women, what stage do people actually recognize that they're menopausal or perimenopausal?
Usually when they've gone pretty far along, because the early signs can be dismissed as other things, right? Maybe I didn't sleep good, maybe I'm not eating well. And a doctor, for me, I was in my late 30s when it started, early 40s when I was in full menopause, which is on the younger side, but it's still within the realm of normal. My doctor kind of dismissed me as, you seem too young. So of course, I questioned that and then had to go do my own digging. But I think women are busy and you can really dismiss a lot of things. So by the time they really know, they're in full menopause when there's no period for 12 months. So that's a real telltale sign. But the 7 to 10 years prior is really when the hormones are erratic, and those are when the big symptoms, come up.
Yeah. And I ask that because I also recognize that people really don't recognize what's happening. As you say, it's easy to make excuses, for want of a better word, as to why something is happening. And as women, actually, we tend to just want to put everything else first and ignore what's happening just because we think we can do it all, and we're just tired or we overextended. Yeah. And so, since we're talking about this, you talk about a lot of women are using alcohol, or maybe not a lot, but sometimes women are using alcohol and food to help cope with their symptoms. And again, it's, for me, perhaps, again, maybe it's a matter of recognition. Do they even recognize that they're doing this?
Yeah, and you're not going to seek the help or admit that there's a problem unless you slow down enough, because slowing down will always bring to light the things that are not where they should be for you, right? And it's not to beat ourselves up. It's not to say I should be eating perfectly and doing all of the things. It's really to come from a place of compassion. And what I teach is intuitive eating. So there's no dieting, there's no counting calories, there's no restricting, because I know for me and a lot of other women, that can backfire. And then you're back to a place of self-hatred, which we're in midlife. We are ready to address what we really need and ask for what we need, as we should, and not be going backwards, maybe to a prior eating disorder that could show back up because we don't know what we're supposed to do. So I think it's slowing down and recognizing where it is things are not where you'd like them to be, and then taking the steps with the proper guidance.
So that just brought to mind another question for me, because and I'm not sure you have the answer, but as you're talking about slowing down, and you know, let us take the example you just gave of your own self, that you started to become perimenopausal earlier than many people. But even so, perhaps a lot of people are perimenopausal and just not recognizing it at that age. In many instances, we are putting off a lot of things based on focusing on career and stuff like that. So that many women at this time still have very young children because they have postponed. And
Mhm.
so again, that
Sure.
is another thing that in my view probably contributes to them not recognizing it, because now here you are starting family at 30 something. And so, you know, you have the young children and you have the full-blown career and you just bought the house and you're now trying to be part of the PTA and all of that kind of thing. You're just expecting to be tired, you know?
Yeah.
And maybe that's one of the things that contribute to us not recognizing it.
Sure, because I do think the inner chatter or the physical running around and being busy can really keep those poor symptoms pushed away because we are just so busy. So
Yeah.
again, I really think the gateway for most women is slowing down, whether it's, you know, making it a pattern or a new habit to walk for 30 minutes every day by yourself, maybe without even a podcast or music.
Yeah.
So you can start to listen to what it is that's coming up for you. And, you know, a lot of the people in our life, they love us dearly, but they're really not going to take the time to tell us we should slow down and we should take care of ourselves. That's our job,
Yeah. Yeah.
right?
Yeah.
Which is not easy for women.
I know. I know we're so conditioned to be everything to everyone.
Mhm.
Yeah. So to come back to nursing for a little bit, having been in this for 24 years now, and especially as a second career, what, if anything, do you think you'd like to see change?
Um, I think the support for women, especially because of it is predominantly women, right?
Mm-hmm.
There's a lot
It
of
still
men that
is,
work
yeah.
in nursing, but and I do see a bit of it when I left the company I was at. They did a good job of incorporating wellness into whether it was emails or different webinars, so that the nurses would know that it is important to this company and to a lot of companies that they start talking about midlife and, you know, hormonal changes and the stressors of life. Of course, just coming off the heels of COVID, right?
Mm-hmm.
It brought to light that nursing is a very stressful career and is very rewarding. And I would never dissuade anyone from going into it because there's so many opportunities and there's so much good that we do and helping people and learning about
Mm-hmm.
all the, you know, the health topics, and it helps us and our families. Um, but I think support for women and more flexibility in some way. I'm
Yeah.
not sure how that can always be incorporated, but um, yeah, I think that would be something that they could do better with.
Yeah, absolutely. Absolutely. We can do better with that. So you just talked about not dissuading anybody from becoming a nurse. What advice would you give?
Well, it's not for the faint of heart. It's a tough career, um, but I think you can find the area that's suitable for you, right?
Yes.
So when I
Yes.
first became a nurse, I floated on different hospital floors, and I didn't like it at all in the beginning. But then I actually learned to really like it because I didn't get involved in the drama of different
Mm-hmm.
areas. I got to meet a lot of wonderful people, and then I finally found an area. The step down unit is where I ended up working for years in that part of my career. So no, I wouldn't dissuade anyone. I would make sure that they're paying attention. I have a niece who now just recently became a registered nurse, working in one area for at least a year and make sure you're giving it enough time, and then start to notice the other areas of nursing that you might be better suited for. Whether it's with children or it's in mental health or it's with the geriatric population or in an outpatient setting. There's just so many different areas based on what's going on for you personally that you can
Yeah.
choose from.
Yeah. If you had to describe what would be the most essential quality of a nurse as you see it, in one word, what would that word be?
Well, you said it earlier, being able to pivot. So if you're someone who needs things to stay the same,
Mm-hmm.
nursing is going to be a problem because there is always changes and it's exciting. I tend to be someone who I like a routine. So it kind of got me out of my comfort zone when I became a nurse. But your mindset has to be that you're going to have X amount of patients and then you're going to get an admission and a discharge if you're working on a hospital floor. And then the patient down the hall could fall out of the bed or, need to be transferred to another unit. So there's always things changing and just making the day go by so quickly. So I would say that's a big quality, is that you have to be able to pivot and change.
Yeah, exactly. That for me actually is one of the biggest and most exciting things about being a nurse, just being able to uh um quickly absorb, assimilate, and respond to whatever is coming at you, and do it well. For me is very exciting. So one last thing before we go. There's a lot of talk about technology coming into the nursing field. How how do you see it affecting the way nursing care is delivered in the next few years?
Mhm. Well, I think it's very advantageous. When I first started again, it was the late 90s. We were writing in charts, right?
Mhm.
So the doctor would come and he would have to find the chart, and things wouldn't be in real time because you might now be down the hall seeing patients and you're not charting their recent vital signs. But when it
Mhm.
turned to computer while I was working there, everything was real time. He would come onto the unit, he or she, one of the doctors, pull up the computer patient records, and in real time, as long as we as nurses were charting,
Yeah,
efficiently, everything was right there. And then when you went into to get the medications for a patient, you had to use a computerized
yeah,
system. There was much less room for error. You had to put in your ID, the
yeah.
patient's information, and scan their, barcode on their
Mhm,
ID. So
mhm.
you were not more than likely going to get that wrong, that the correct dose was delivered to the correct patient, correct
At the
medication.
correct time. Mhm.
Otherwise, the system would alert you if it was working properly. And then when I went to home care, every nurse has a laptop. She uploads after every patient visit all of her notes. And those of us in the office could see in real time what was going on with those patients. And I believe Epic is coming on board for that healthcare system, which is
Mm,
the medications and
yeah,
health history. So when patients are in the hospital and they come into home care, all of that will transfer
it
over so that the
flows.
nurse
Mhm.
is not digging through the paper copy that's
Yeah,
scanned into the computer, or she could essentially miss something, right? If she doesn't
yeah,
read, every
yeah,
medication correctly, or it doesn't get transferred over correctly. So I think, yeah, that for me, technology, unless the system goes down, then that's a big problem. But I think technology is really helpful, and that's another area, health informatics, right, for
yeah.
nurses, so
Mhm.
they can go in if they're maybe done with working, in a client-facing role, they can slide into that sort of
Yeah, yeah,
that sort
yeah.
of
And
nurse.
that's really a huge burgeoning specialty coming up. Yeah,
Mhm. Yeah, yeah.
yeah. So What do you do for you to take care of you?
Oh, well, exercise is non-negotiable. I walk every day, or run a few days a week. But I'm also, you know, I take the time to recognize there might be days where it's okay if I'm not exercising, right? So I try not to live in extremes.
Mm-hmm.
I enjoy reading. I enjoy being outdoors as much as I can. We have two grandsons that are just the light in our lives. So being with family, being outdoors, exercising, taking care of my health is, yeah, reading.
Yeah.
I have a lot of interest at this point. I think it's as we age, we should try all sorts of things and find what it is we enjoy or what we're good at. Maybe I should start, I don't know, a musical instrument. Maybe I have talent. I don't know.
You know what? I absolutely agree with that. I figure my basic philosophy is that if I'm breathing, there isn't anything that I wouldn't learn if the opportunity arises. So,
Mhm.
just go ahead and
Yeah.
do it. Just go ahead and do it.
Keep it interesting, right?
Yeah, just do it.
Mhm.
Kathleen, thank you so very, very much for this conversation. It was truly interesting. I really appreciate you doing this. Thank you.
Yeah, thank you, Dale. Thank you.
My pleasure.